Good to see you again. So the topic of this conversation is free healthcare. It's a topic I've wanted to talk about for a while because it keeps coming up all the time. So first I should mention that on the political spectrum, I'm actually 3.8% on the left and about 14% libertarian. So this is according to the political compass test, and I'll leave a link to the test below. So that sort of makes me like a centrist, a libertarian centrist. And being in the centre, I tell you, being in the centre is not exactly the best place to be sometimes, because it means you get to be aware of both sides of the issue. Sometimes I just wish that I could just be either on one side, but I'm right there in the centre. So when it comes to free healthcare, there's two words which stand out. First is free, the second is health. So free healthcare? Give me a break. Nothing is free. Nothing is free. Somebody has to pay. And so the government will tax the citizens and the corporations, and then redistribute that money according to according to their criteria. I was going to say how they feel, which is probably more appropriate actually. So nothing's actually free. There's always a cost involved. You have to remember this. And then we come to healthcare. What do you mean by healthcare? Because are we talking about mainstream Western medicine? Or are we talking about the other types of Western medicine, like German integrative medicine, Dr. Hammer's New World Medicine, and naturopathy and Ayurvedic medicine and traditional Chinese medicine? And then there's all the allied fields like psychology and NLP and hypnotherapy, etc., etc. You know, what are the defining criteria for saying that the government will provide these services free, but not those services? Who gets to decide? And this is where there's always that risk of cronyism and corporatism, where you get like a collusion between the market and the medical system, medical industry, and the politicians and the bureaucrats. So there's four entities. I think I mentioned patient, the practitioner, there's the government and the taxpayer. So let's look at the patient first in respect to personality types and meta programs. So are the individual preferences respected in a free healthcare system? Now, I'm very much an individualist. I'm not a collectivist. I'm an individualist. When I go and see a doctor, for example, I don't go and see the doctor because I want him or her to take care of me. I go see them because I want to get some advice. I want to use their expertise. Now, I like to be in control. I like to take care of myself. So my locus of control is here. It's not out there on my own authority. I don't have an external authority. And in terms of the medical profession, my personal experience has been that most of the mainstream doctors I've seen throughout my life have been like really below average. Some have been downright dangerous. And yet there's been a few who've been really good. And then the best the best doctors I've ever seen, there's actually one who's actually a German. He's actually a German, but he practices integrative medicine. And he is really good. But I have to pay him, and he charges a lot. So I can't always afford to go and see him. So what I tend to do, I don't see anyone until I get the cash, and then I go and see him. So for me, it's really important. And then when you look at naturopaths, I've been to lots of naturopaths over the years, and most are pretty average, but then you get a few who are really good. And I've also seen other types of practitioners and that sort of thing. But what for me is important is that I have the choice to be able to shop around and find the best person to meet my specific needs. So in terms of being like the patient, it's like you'll get those people who take care of themselves and those who don't. So it's like having a present to future, it's a cause and effect consequence type thing. It's like being aware of the possibility of what could actually happen if you don't take action, or being aware of the possibility of the consequences of what could happen if you do something. So if you drink too much alcohol, you take drugs, you smoke, there's a consequence. Some people are aware of that, which is why they don't. Others are just much more present-oriented. So why should it be that those who don't take care of themselves are able to access the free healthcare system which we've all contributed to? Another example is I used to surf years ago. I'm in Australia. I used to be on the west coast. Then I moved across to the Gold Coast in Queensland on the east coast of Australia, not far from the beach, obviously. And so when I used to surf and go in the sun, I used to wear like a little cap, a little baseball cap type thing. It used to cover my ears, so it actually protected my ears. And I tried wearing sunglasses for a while, because when you're out there in the surf and it's really glassy and you've got to look along the face of the wave and the sun's really low, like burns the eyes. It's not really good. So I used to take care of myself. I used to wear a lycra shirt. Sometimes I'd wear a wetsuit. I put block out on and all that sort of stuff. So I took care of myself. And here I am at 63 years of age. My skin's not in bad condition. It's in pretty good condition, all things considered. And yeah, I've seen other people, I've seen just people in their 20s who've had the skin of like a 95-year-old. And then you see the older people and they've had ears cut off and noses cut off because of cancers and whatever, because they didn't take care of themselves. So you get these people you get those who take care of themselves and those who don't take care of themselves. And then when it comes to free healthcare, why should it be that the taxpayer has to take care of these people? Shouldn't it be that we put the money into educating these people to take, preemptive action? To take care of themselves so they don't need to see the doctor? So you get those who take responsibility and those who put the responsibility onto someone else. And then we come back to then we have a look at the practitioner, the health practitioner. So once again, there's like two sides to it. So the practitioner provides the goods and the services. And if you have a free healthcare system, what it means is the practitioner is getting paid by the government, getting paid by the taxpayer. And do they have an incentive? Is there an incentive for them to keep up, do their latest research and to provide the best service? Or are they just bludgeoning off the system? Now, if there was a system where it's free and you see one doctor and he's useless, but then you have the choice to be able to look for another doctor, and you keep hunting around until you find the best one. Let's say they all charge $100 an hour and you get to see the best one. Well, let's say it's free, but you have choice. Then that doctor gets inundated with patients. Now, in the free market, what would happen, and what does happen is that the doctor who's just average, maybe he just charges $100 an hour, but the doctor who's really good, charges $500 an hour. And they can do that because there's the demand, because they get the results and people will want to go and see them. Now, it doesn't necessarily mean that people like myself will have that money to go and pay the $500 an hour every week. But it's a way of it's a way of incentivizing the doctors, the healthcare practitioners, the naturopaths, etc. It's a way of incentivizing them so that they deliver the best service they possibly can. And I don't think where you get like a totally free healthcare system, I don't know anything about the National Health Service in England or Denmark or those Nordic countries, but I'm just wondering how much choice does the patient get, and how incentivized are the healthcare practitioners to deliver the best service they possibly can. And it's sort of interesting because I watched a video by a Swedish guy a few days ago, and he was saying, because you get some people will look to the Nordic countries like Sweden, Denmark and whatever and say, look, socialism works. It's like, well, they're not socialists for a start. Not much more socialist than Australia or America. And Sweden, it's a homogenous country, homogenous population with culture and religion and values and that type of thing. They built their wealth on the free market, and then they looked at building a healthcare system. So they built their wealth on the free market, and then they started building a healthcare system. But also concurrent with that, they had a value system which kept it in place. So this guy was saying that each person was incentivized to take responsibility for themselves to do the best job they possibly could. So, and then what they did is they actually made sure that their friends and family also took care of themselves, went out and did the best that they possibly could, so that they would be the least burden on society and be the most productive. So that's how, like a socialist state or free healthcare system can actually work. But as soon as you get the population becomes more multicultural, and you get different religions, different values, different ethnicities, etc., is it going to work? And I don't think so, because I think there's this like a saying, laziness begets laziness. So welfare, free welfare, like a welfare state begets a welfare state. So if people aren't incentivized to take responsibility for themselves, take care of their health, take care of their family, and take care of their everything, if they're not incentivized, then what tends to happen is people just actually start to put that responsibility onto others, which onto government, onto bureaucracy. The bureaucracy grows and people aren't taking responsibility and everything starts to fall apart. And I think just to finish this video, I might just mention that when the Pilgrims arrived in North America, they had a socialist system for about 3 years. So they had like a farming collective where they all worked it as a collective. It was a socialist type system. But what actually happened was that they actually just didn't get the yield and they were starving. So then they decided they would maybe try a free market approach and give every family a block of land. And then what they found was really interesting, because then you had the guy who'd been complaining of a bad back. Now he's out there in the field. He's even though he's crook, he's out there and he's still working. And then you get the mother who's got, you know, a little baby and 2 or 3 little kids who'd been staying home sometimes to take care of the children because of the enormous responsibility she had. You see her, she's out there in the field. You know, she's strapped the little baby to her body there, and the little kids are helping her. And when people are incentivized, they work harder. They become more productive. And because somehow there's a personal investment in actually a personal investment and a satisfaction that you get from taking responsibility for yourself. So I think I might just leave the conversation right here. So if you enjoyed the video or not, let me know if you didn't enjoy the video. I'd really like to know, you know, how I could actually improve. And if you do like the video, please subscribe if you haven't already done so, and share it. And I look forward to seeing you again. And remember to keep on challenging everything for the truth. I've spent my entire life doing that, and I would like to share some of my discoveries with you. Whether you're an atheist or believe in a higher power, my book on God is sure to get you thinking. And part and parcel of spirituality is learning how to work with your unconscious mind, such that you can quieten the mind and get yourself to sleep when you need to. And that includes the ability to banish bad habits like cigarettes, marijuana, alcohol, chocolate, and overeating. And as a foundation to a fulfilling life, I believe everyone needs to learn how to work with their unconscious mind, how to explore deep trance and states of deep meditation. If you want to connect, you can find me on Facebook at Abbey Eagle School of Meditation.